The international outcry over China's practice of harvesting organs from executed prisoners has generated a heated debate in Australian academic circles. Last month, 7:30 revealed that Sydney University was under fire for awarding honorary titles to the Chinese surgeon who ran the transplant program. Dr Huang Jie-Fu has always kept a low profile, but now he's gone public in Beijing to answer his Australian critics and to claim the harvesting program will soon come to an end. But as China correspondent Stephen McDonald reports, Dr Huang's detractors are sceptical.
ABC. Yes, sir.
Dr Huang Jie-Fu has been facing heavy criticism in Australia. To his supporters, he's a pioneering liver transplant surgeon. To his detractors, he was responsible for running China's organ transplant system for more than a decade, a system that's relied almost exclusively on organs taken from executed prisoners. In a rare press briefing, Dr Huang spoke to a small group of journalists to respond to his critics, saying Chinese prisoners must agree to have their organs harvested before they die.
Consent is not presumed consent. Consent, written consent from the prisoner himself or herself, as well as his or her family.
But some say that consent from prisoners condemned to death isn't meaningful consent. So medical groups, the United Nations and the World Health Organization have criticised China for structuring its transplant program around organs taken from prisoners. As China executes as many prisoners every year as the rest of the world combined, there's a steady supply. Even today, Dr Huang defends the practice.
Can I just ask you though, if they're not being pressured into donate their organs, why would they do it?
Before he died, he found consciousness and found that he needed to do something to repay the society. So why you object?
Last year, there were 5,846 kidney transplants in China. More than half of the organs came from prisoners. Of all liver transplants, 80% came from executed prisoners. But Dr Huang says that for the past 2 years, in his own practice, he's not taken any organs from the jails.
But in the past, you probably did.
In past, yeah, I did.
And as a doctor, how do you feel about that?
I feel that the first, I respect the donor. I respect the life he donated for other 3 peoples.
Enver Tohti is an ethnic Uyghur from far western China. He fled to London after a traumatic experience while working as a surgeon in the 1990s, when he says he was forced to remove organs from an executed prisoner.
It was really a terrible memory. When our surgeon told us that wait outside that execution ground, and they said that come in, and as soon as you heard that gunshots, so we did. I guess it was a prisoner who got shot, and blood and mud on his face. And so our chief surgeon said, okay, hurry up. Now your task is remove his liver and 2 kidneys.
What's more, Enver Tohti says the prisoner had not yet died when they were removing his organs.
And what I have noticed that the gun wound was on his right chest. So I guess that was deliberately to make this prisoner not die immediately, to allow some time for us to remove that organ when he is still alive.
For critics of Dr Huang, it's practices like this which mean the man previously at the helm of such a system isn't worthy of his association with Sydney University. 7:30 reported last month the petition campaign led by Professor Maria Fiataroni Singh, calling on the Vice-Chancellor to strip Dr Huang of his titles.
We shouldn't be giving him any publicity or honour for the kind of things that he's done.
Yet Dr Huang knows many doctors at the university will be prepared to back him.
I can show you a statement from the Sydney University Medical School. I got a strong support from them.
No, so I understand you have strong support in the faculty, but other people...
I don't know who is other people. I couldn't make a response to the strangers. And I didn't know her at all. This is the first time I know the name. The first time, that's true. I don't know.
And what of the other doctors who've signed on to the petition opposing him?
It's unnecessary for me to pay attention to that because, I have my values. So I don't want to waste my time to talk about that.
Within the international medical fraternity, there are surgeons who see Huang Jiefu as a liver transplant champion who's helped usher in China's new public donations system, which is crucial because at hospitals like this one, for every one patient that gets an organ, there are 30 more people waiting. But now we've been told that China's near complete reliance on prisoner donations is about to come to an end.
From the progress we have been made, I estimated in 2 years will eliminate the heavy reliance on the prisoners' organs.
Yet his main critic at Sydney University isn't convinced.
I do believe that they're trying to move away from the system of using executed prisoners, but I think that the real point is if something is unethical, then you don't suggest that you're going to move away from it in a few years. You stop doing it now. By his own words, 95 to 99% of the transplants were from executed prisoners, including the transplants that he did himself. So I don't see how you can give him an honorary professorship in the light of that knowledge.
But Dr. Huang says the world needs to be understanding and give China a chance.
Gradually, now we see China is changing. Progress is being made.
Stephen McDonald reporting from Beijing.